Welcome back to Arizona Midday. October is National Liver Awareness Month, and we're sharing why it's so important to focus on your liver health and the risks to look out for. Here to tell us more is Dr. Saran with Bright Endocrinology. Thank you for joining us.
Thank you for having me.
Okay, so this is an important topic to talk about, but before we get to the liver, what is unique about your practice, Bright Endocrinology, and what makes it different from other practices here in the Valley?
So Bright Endocrinology is a direct care practice, meaning we don't accept insurance, but this allows for longer appointments, easier access. My patients have direct access to me, and in the long run, this can actually save people money.
Yeah, so that's important too, time, right? Because I know it's hard to get into doctor's appointments, and sometimes...
For an endocrinologist, the average wait is 3 to 6 months.
3 to 6 months, and if you're having issues, you want to be seen right away.
Yeah, exactly.
Okay, so let's get back to that liver. So what impact can the liver have on the metabolic disorders?
So liver health is really essential. Patients who are overweight, who have fatty liver, they may have diabetes, they have higher risk for complications such as cardiovascular disease and even chronic kidney disease.
Okay, so let's talk more about those risks. So what risk factors should people be concerned with that might increase their risk for developing fatty liver disease?
The most obvious one is if people are overweight or obese. You know, we traditionally place a BMI cutoff of 30, but even people with diabetes, men are slightly more likely to have fatty liver, but the risk goes up when women go through menopause.
Oh, and why is that?
Estrogen is a hormone that affects all of our body.
Okay, and so that changes everything in your body. A lot of things change during that time.
Yeah, after menopause, women will lose muscle, they have increased fat, and so a lot of that, if it stays in the belly, can go to the liver.
Good to know, right? So it's important to keep an eye on that for sure. So what are the benefits of using Fibroscan compared to traditional methods in diagnosing and monitoring fatty liver disease?
Fibroscan is amazing. This is non-invasive. The gold standard before was an ultrasound, but it couldn't quantify how much fat was in the liver. This is able to tell you how much and if there's inflammation, if there's scar tissue. Before, the only way to know is to do a biopsy. Patients would have to go in and get a needle all the way through their belly to the liver in order to get an answer, and this is much more cost-effective and safer.
And this is probably more helpful for patients because if that was the old procedure to do it, people are probably like, I'm not going in there to do that.
Yes, this is painless. It takes 10 minutes.
10 minutes, okay, and it's easy. Okay, so if someone has fatty liver disease, what can they do to treat it?
The main thing is focusing on a healthy lifestyle. Weight loss is key. Now there's some new medications on the market that can help with weight loss. And we really focus on prevention. And this scan can be repeated every 6 months, so I'm able to track people's progress. And again, it's painless, 10 minutes.
10 minutes. Okay, so let's talk more about prevention. What are some things that people can do to avoid a fatty liver?
So keeping a healthy lifestyle, exercise, following, a lower fat diet, and anything that helps keep a healthy weight.
Okay, and so let me ask you this. People watching at home, they're like, I do feel uncomfortable sometimes. So what are some of the signs that they need to come in and see you?
So that can be tricky. A lot of times this is asymptomatic and routine blood work can miss that. So anyone who's overweight, BMI over 25, anyone who has diabetes, high cholesterol, those are the people that we should be screening.
Okay, and then why is this important to you?
I am passionate about preventative care. I'm not just giving people medicine to treat a condition. I want to prevent them from having that condition, from needing that medicine. I want to keep people out of the hospital, keep them healthy, keep them active.
Perfect. All right. Well, thank you, doctor, for joining us this afternoon and sharing all that information.
Thank you for having me.
And if you want to learn more, go ahead and visit brightendocrinology.com or call the number there on your screen.